Good morning, guys. Welcome back. Karen is in the house.
Yes,
today.
I am.
All right. So anything that we say is not meant to diagnose you. It's not meant to cure you. Just for your information, check with your doctor before taking any of the advice. Okay? So there's a couple things we want to talk about. I have a quiz coming up, actually 2 tiny quizzes, but they're very interesting. Also, I'll be releasing some videos this week about keto trolls, keto haters. It's going to be interesting.
It's fascinating that someone could hate.
I know.
Be a hater. This takes hating to a new level, doesn't it?
It's just
for
weird.
those who are studying. This is like hating 301.
You could put an amazing success story. I mean,
Someone
true,
feels
amazing,
better.
And someone actually is like,
How can you hate the fact that someone is doing better and feels better and is healing? How can you hate that?
You're going to find out in the video. There's a reason for that. Also, I'm going to do my opinion on this Game Changers Netflix plant-based film, so stay tuned for that. I probably will release that maybe, I don't know, tomorrow or the next day.
Okay.
Also, I'm going to talk about why, I'm releasing these videos, by the way, why gastric bypass reverses diabetes and about 16 other diseases. I'm not recommending it, but it does reverse disease.
According
and we're going to talk
to
about
who?
why. No, it's actually true, according to some massive studies.
Oh, okay.
But
So you're not recommending it?
no, I'm not recommending it.
But it's a fact.
Right.
Okay.
And then I'll be talking about some other things that are just a surprise. I'm not going to reveal them yet, but really cool stuff. That's right. We have a lot of callers. I'm going to jump right into Rowena from Connecticut. Are you there?
Yes, hi,
Hi.
Dr. Berg. Yeah, my daughter wanted to, I'm advocating for her, but she wants to know, how can you do keto if taking the electrolyte powder or drops make your heartbeat go down? Because she wears one of those little smart watches, and it went down to like 38 a few times at rest. So I'm just wondering, she doesn't do the electrolyte drops anymore. It stopped doing that, but she also suffers from a low thyroid, and she's not taking the armor that the naturopathic doctor suggested. She hasn't gotten to that point yet, and she could be having Hashimoto's. My mother and my sister have it, so I don't know if that all comes into play.
Okay.
With a heartbeat.
Okay, so this is what I would do. Definitely stay tuned in the next few days. I have another video on how to get the thyroid to work better naturally, and because there's certain reasons why the thyroid is low. It could be potentially she's not producing the hormones, but it can also be potentially she's not converting from T4 to T3. So watch the video that I just released on thyroid, as well as the videos I'm going to release on Hashimoto's and thyroid. Very important for her to understand that. And keto and IF is the best thing for the thyroid, by the way, because it decreases the need for using the thyroid. Now, as far as electrolytes, what happens is you're taking these minerals, specifically potassium and magnesium, that calm the cardiovascular system. So it can definitely lower the heart rate. Now, it's not a bad thing because it actually is. We're not giving you we're not giving a drug. It's a natural thing, and it's about 1,000 milligrams per scoop. So maybe what she could do is take half and see how that does. As long as she's not feeling bad, it's going to be totally fine. The thing about potassium is, though, that's one mineral that the body will get rid of anything that it doesn't need. So versus sodium, which you retain that, potassium, if you take a little more, the body will get rid of anything it needs. But potassium is so important for the electrical system of the heart, for energy. So stay tuned. I'm actually creating a book on potassium that relates to that question, but I think it's going to be fine. All right. Now we're going to go right to Canada. Mayhum, are you there? Another question. Another question,
Hello?
I guess, on Hashimoto's. You have a question, right? What was your question?
Yes, I recently diagnosed with Hashimoto's and PCOS. So I did go online and checked out your video. You have individual video on both, but not together. So my question is, I saw your video. You recommended saw palmetto for PCOS. I started taking that. I saw a lot of improvement. I'm not breaking out anymore. My periods were a bit better. I had like my testosterone level went down to 0.3, and my LH level was very high before and went down after the test. But I'm just wondering if there's anything I can do to have both better, and is there any contraindication to any supplements I'm taking for PCOS or for the Hashimoto?
Quick question. Are you doing healthy keto and intermittent fasting yet?
I am.
Okay.
I am.
Good. Yeah, I think the best thing to do is combine both of those recommendations together. Hashimoto's is very fascinating because there's a lot of theories out there. There's a huge connection between Epstein-Barr virus and Hashimoto's, and 95% of the population has Epstein-Barr virus. It's like that kissing virus you get when you're in college or high school. So that virus kind of stays dormant and kind of comes out later in life as a latent type, it's called latent virus, and it can actually affect the thyroid. I'm going to release a video on all the natural things that you can take as an antiviral, but the real big solution is to stay super healthy, eliminate all stress, and stay young, and then you're going to be totally fine. So as long as you avoid all stress and all junk food and don't age, you're totally bulletproofed. And I'm being very sarcastic. So you're going to have to get your body so healthy because you can't really kill a virus. You can just keep it in remission. And there's a lot of things that will trigger it. Watch my video on viruses. I think that would be a good thing for you to do. All right, Karen, do we have any questions coming in?
Yes.
Great.
Here's a question. Can we ignore vegetables on keto?
I'm going to let you answer that one. I'm going to let you answer that one.
It's like the puppy that hears a funny sound. Hmm?
Right.
No.
Good. Good. Any other questions?
No.
Okay.
I have a question. First of all, several people today complimenting my hair. It's a crapshoot. Some days it's
She
better
was
than
born with incredible hair.
Some days it's better than others. A lot of people asking me what I do for my hair.
You should do a video. We'll do a
So
video.
you don't want me to say anything?
No, go ahead. Go ahead.
Well, I mean, keto and IF, for starters. The other thing is organic as much as possible. I don't wash my hair every single solitary day. I use coconut oil in my hair. But I wouldn't say that it's, you know, clearly some of you saw me with some highlights, so it's not like I'm like the...
It's Suave shampoo, buck a bottle.
It's not like I'm like a total purist or what. I'm looking for a word, you know, like someone who never does anything to print. But I mean, it's probably the keto and the IF and making sure that I have a lot of good fats.
Yeah, she doesn't go low fat.
I don't go low fat.
No. And the fats actually are really important for hair.
Yeah. So I mean, it's for hair and skin and stuff like that, I always try to find something that's not full of crap and as simple as possible. And like any other female, I go through tons of things experimenting, and there's not one brand that I use. I'm always trying something different. And other than that, it's
Can I just say one thing?
yeah.
So
I'm sorry, I don't have like an ironclad, you
prepared
have
for
to
that.
do this in order to have hair like this. I do have naturally wavy hair, so so that helps.
there's a couple things that I noticed at one time in your life you were losing a little hair, but that was during like I think pregnancy or something or stress or something.
No, with my cycle, and then it got much worse during pregnancy, and then it just continued with my cycle. I would have like huge gaps of hair loss, and then it would immediately grow right back.
Right, but one thing that's different, you get actually way more sleep than I do. which I think also helps. You get like probably 8 hours.
12 hours a day.
12 hours a day. So that I think that really is important for just
I don't
maintaining.
get 12 hours a day. Steve?
No.
Really?
No,
You
just
believe
kidding.
that?
No, not 12.
11.
But you definitely
Guys
get
got to stick together.
way more sleep than I do. I think that's helping your hair a lot.
Yeah, I almost always get 8 hours, sometimes 7, sometimes more,
Well, I like the idea.
rarely more, but
I like what you suggested recently of going to bed early, like 7:30. That I really like that.
recently, and that was just last night.
I like it. I think that works for me too. Okay, so Lori has been waiting patiently for 15 minutes. Lori, are you there?
Okay.
From New Jersey.
Yes, I'm here.
Hi. What was your question?
My question is, with OMAD or intermittent fasting, I've been taking your veggie solution and your cruciferous superfoods,
Yeah.
and I just wanted to know if that breaks a fast if I take it before my one meal.
Yeah. Okay. So the definition of breaking a fast is just anything other than water. However, the amount of those things, as far as breaking your fast, are so small, it's insignificant. So I'm going to tell you, no, they're not going to interfere with your fast at all. The veggie solution is very interesting because even though it has some carbs, most of those carbs are fiber and related to phytonutrients, but there's 0 sugars, and it's a pretty interesting ingredient in the veggie. It's a solution. It's called lentine protein. It's a very small, so like the smallest flower on planet Earth. It's a small flower, and it's grown in water, and it has tons of chlorophyll. It's the highest protein plant protein on planet Earth, and it has the phytonutrients and omega-3 fatty acids, all sorts of things. But yeah, that would not break your fast. But thanks, Lori. Karen, I think we're ready for a quiz. It's
Sure.
let's here's the quiz. Out of all the foods that people eat, what is the food that gives you the most pesticide exposure, or what has the most pesticide residue? What food? Let's see if you guys could guess that.
Okay. We'll just sit silently and stare at the screen.
We're just waiting for their answers. Let me
No,
just.
because it's interesting, because I remember being told many years ago what the worst one was, but I'll be interested to see.
That's right.
I mean, I don't have any current information on that.
You don't
Haven't
have
done
any intel?
homework, and we haven't heard you talking to me about it at 5 in the morning.
I was withholding that information.
So,
Well, while people are answering, let me just go to Loanne from
Okay.
Illinois.
sure.
You had a question about the pancreatic body type. Go ahead.
Hi, yes. I took your quiz and was the pancreatic body type and some like thyroid thing, but I'm losing my hair. I've been on keto for about a month and a half, and I've been loving it, except for my hair loss. And I'm like, what is the one supplement? I'm already taking the nutritional yeast, but what is the other supplement that would be best for me to take to get my hair back?
But listen, Loanne, listen, you're losing weight. You're feeling great. I mean, what's the hair loss? I mean,
Don't
is that
say it. Don't say it. I knew he was gonna say
I'm
it.
No,
I
just-
did
This
this
is
for
where
my
you
daughter's
listen.
wedding. I don't want to be bald going down the hair
Come
aisle.
on. I mean, like it's the trend nowadays. Now, here's.
No.
Do you realize that I have a very special thing for hair? It's called hair formula. Did you realize that?
I do, but I was confused whether I need to take that or the gallbladder formula.
Oh, okay. I would take.
Because if I'm not absorbing one.
No, I would go right for the hair formula because that's a very specialized thing that has about 4 or 5 different angles into hair, and that produces some serious results. If you look at the reviews on that, I mean, people are just loving it. That's what I would start with first. That usually will help you. If there's still some issues, then you can take maybe a little more trace minerals, a little more B, but I don't think you're already taking nutritional yeast, so I think we ruled out B vitamins. And then there is one additional thing, but I don't want you to get it yet. It's not even on the site, but it's basically going to boost. It's like a hair booster, but I would go with the hair formula. That should work like fine. So try that. All right, Karen?
Okay, here we
What
go.
do we got?
Okay, so specific foods. You didn't mean categories, right?
No,
you
a
didn't
specific
mean
food.
like vegetables.
No.
Okay,
It's a
good.
specific food.
So the top answers are soy and corn, coffee, strawberries, celery, apples or grapes. Those are the top. There's a couple other random things, but
Okay, so I'm going to say, Karen,
yeah.
the answer is on that list.
And I will tell you that
What do you
I
think?
understood from hearing something random years ago, it could have been from you, strawberries.
Karen is correct,
And
sir.
so are the strawberry people.
Yes, that is a correct statement. Good. So yeah, it's strawberries. So that's like
sad.
Yeah. So you want to go organic with strawberries. The video that I released on this will give you the additional 11 more in order of, and celery is on the list.
So just go organic
So are apples, so
everywhere
are
you
grapes.
can. So let me ask you a question.
Yeah, ask me a question.
So when you go into a store like Whole Foods or any kind of natural, you can buy these sprays, a fruit wash
Yeah.
or a veggie wash. What does that ever really do anything to wash the pesticide off?
The problem is that these pesticides do, first of all, they go in the soil, so they're absorbed through the roots from the inside out.
Right.
And then ones that are sprayed, like even on a lime or a lemon, they can go in. So the outer shell does act as somewhat of a barrier, but you're still getting pesticides, unfortunately. So there's really one thing, one food that you don't really have to worry about pesticides.
Let me guess.
Well, let's ask everyone
Oh,
first before
but
you guess.
is it even a food that we can eat?
Yes.
Oh.
And what we'll do is so here's the next question, guys. Since Karen brought it up, what food has the least amount of pesticides that would be okay to buy that doesn't have to be organic?
And it's not a
Ding,
nut.
ding, ding, ding. Now, well, let's see what people say. Okay.
And it's something we can eat. Because I was
Yes.
going to say banana, but that's
Well,
not on our list.
Right. So, but here's the thing. Yeah, there's some washes. You can get rid of some of the stuff if it's maybe an apple, but we're not eating apples. The problem with the leafy greens is they don't have like a shell that you peel, like salads. You can't peel a salad. But there are certain vegetables that you can take the.
Peel your lettuce.
Hey, that's
That would leave for a very, while people are answering, here's an interesting question. Is there a recommended daily allowance for fiber?
No, there's not. They're trying to classify it as a nutrient. It's actually not really a nutrient. However, I will say, I think it's very important because it does feed your microbes. So it's not for us, it's for these little microbes that live with us and that give us nutrition.
Okay.
So I'm going to call it a nutrient, but there's no requirement for that.
Okay.
It's my opinion.
And which is why we are all gathered here today.
Well, here's the thing, Karen. I think that it's really important, since we're talking about opinions, is that just to have people realize there's a big difference between an opinion and a fact. And on the internet, oh my gosh, you talk about opinions. Facts are based on evidence. Opinions may or may not be. So if you're trying to evaluate something and searching, doing Google searches, just really keep in mind, try to just stick with the facts.
I can't even say what I'm thinking right now.
Yeah.
I mean, you're searching on Google.
Right there. Especially recently, it's like amazing. Just like when you're searching for health stuff, like you have to dig, you can barely find anything.
There are entire subjects that are no longer on the web available.
Yeah.
I'm not just talking politically.
No.
There are entire subjects
It's
that
almost,
you cannot find anymore.
I know this might sound crazy, and it's almost like someone doesn't want you to get healthy. And that was sarcasm.
That was sarcastic.
Yes.
I sensed that. Hey, but the answers, for the most part, is avocado.
Really? What do you think?
Well, I first thought avocado, and then there's things like pumpkin, and I mean, I know pumpkin's pretty easy to grow, like squash. I don't know how much you have to spray a squash, but then I'm thinking, well, how much are we supposed to be eating squash? Because some people did say.
So what is your answer?
Geez, my answer, I'm relying on these guys. I thought I was supposed to be the voice of the people.
What's the answer?
Avocado.
Thank you. You are correct, sir. Yes. So you're 2 for 2, Karen.
Okay, good.
You're 2 for.
Good.
So basically,
Guys,
avocado
keep making me look good.
apparently the outer shell of an avocado, the peel, is pretty strong to protect that plant against, and it has the least amount of pesticides. So that's good because avocados are a bit expensive, and especially organic.
Let me ask, since we're talking about food.
Yeah.
What about chickpeas? Can someone eat chickpeas on a keto diet?
I'm not against having some, but they are a legume and they do have some carbs. However, when you're actually combining it with olive oil or tahini, you get hummus, which doesn't seem to affect ketones that much. So I think if you're having it with some oil and things like that, I think it's going to be fine.
What if you're just tossing them on your salad, or you're
I think it's
throwing
gonna
them
be
in
fine.
something hot?
I would not even worry about that at all. That's probably equivalent of a berry.
Okay.
Yeah.
Good.
Yeah. So now Teresa from Tennessee, are you there?
Yes, sir.
All right, great. What's your question?
Well, I did have a question, what I told the interviewer at first, but I'm fixing to have all my teeth pulled, and I don't know how to keep doing keto while, once I have all these teeth pulled, 18 of them out of my mouth.
Wow. Well, that's a good question. I think you can still do keto. You just need a nice solid blender. So you just start blending your food and start drinking your food. You can do the kale shakes. You can blend your steak. No, I don't know if you can blend your steak.
You can do you can do steamed vegetables.
Without teeth, you can chew them.
On keto. Very steamed.
So
Yeah, I guess you'd have to puree things, or like when we first started doing all the kale, we didn't chew all the kale because I didn't want to chew all the kale, so I would put 7 cups of kale in a blender, and that's how I got my kale. So you can do it. You just
take berries, kale, freeze it, and then when you're ready, you just blend them together. That could be your salad right there. So then you just have the protein, and there's various sources of protein. You can do a protein powder, whatever, but I think you can do it until you have a chance to put those teeth back in, which could take some time. I mean, if you're actually having them implanted. But yeah, that's what I would do. Good question. Okay, so what do we got?
Okay, so here's someone who gets only a little bit of sleep. Is that going to affect her weight loss?
Yeah, that's a huge factor with stalled weight loss because your metabolism drops down. It's interesting. They've actually even induced prediabetes within a very short time of cutting sleep down to 4 hours a night. I think it was for 6 weeks or something like that, just like people start getting prediabetes. So you ever notice when you don't get sleep, you're hungrier? Well, not you, because you're always getting sick. But other people might notice. Steve, you remember when you don't get sleep, you get hungry?
Oh, yeah.
Yeah, see. So for us people who don't get 8 hours, I mean, your hunger appetite goes up, and that can affect the blood sugars.
But you nap all day.
That's a true statement. That is a true statement, Karen.
I have another question here.
Yeah.
Sorry, I'm not catching names, but someone has had, for his life, tics, I guess, body. He doesn't expand on what they are. Could be body or facial or something like that. Is there something that he can do to minimize that or support the healing of that?
That's a very good question. I just wanted to make sure that my my video on tics is actually posted.
Did you just do it?
Yeah, I just want to make sure I have a video and everything, and let's just see if it's on there.
Hold, please.
Yes, it is on there. I'm going to just suggest you watch it because there's a little bit more in-depth answer. And this is one thing that when I realize, guys, I go through a lot of your feedback and your reviews, so I appreciate all the comments that you're giving us. But I will say that all the questions, I just don't have time to create the links. They're all on YouTube. If you just do a search on every possible little thing, they're all right there. Just FYI. All right, do we have another question?
That was the end of my questions for the moment.
Okay, good. Well, let's go to Dana from Fort Worth, Texas. Are you there?
Yes, I'm here.
Hi.
I can't find a video on this, but I'm kind of combating two things that are kind of opposite. I have icy interstitial cystitis in my bladder, and then I have acid reflux really bad. So I'm trying to build the acid in my stomach, but when I do that, then my bladder starts getting irritated. So I didn't know if you had.
I do have, if you look under, do a search just in Google, Dr. Berg, and then bladder or bladder infection or pain in the bladder, I would look at that. The best thing that you're going to get probably benefit from is doing prolonged fasting. That's probably going to help you more than anything. The other thing that you're going to have to do is take something like oregano oil, take it in a capsule, and then take that on an empty stomach a few times a day, just to kind of help clean up the internal part of the body so you can handle the bladder issue, because I do understand the stomach problem is hard because that can aggravate the bladder. So it's a little bit of a catch-22. The thing that you, I think, would benefit from is maybe instead of adding the acid, just consume fermented vegetables. That might be a little bit better. And then make sure you do healthy keto, low carb, because that's going to help the immune system and definitely help the bladder. But I do have a video on that. Thanks for your question. All right, now Suzanne from Toronto, Canada had a question. What was your question? It was for your daughter, right?
Yes. Hello?
Hi.
Hi, how are you?
Great.
First of all, I have to thank you very much. I'm your fan. I love you. You saved my life.
Oh.
I lost 40 pounds in 2 months.
Wow.
Actually, 3 months. I went from size large to small.
Wow.
And I cannot thank you enough. Yes, I'm very, very happy I'm talking to you.
Oh, that's great.
Thank you. My question is for my daughter. And for the people who are underweight, she's very slim, skinny. But your videos always talks about like who overweight and they want to lose. I wish I'm her, but yeah, she's blessed. But also, my question is, if people like if they have problem with the insulin resistance, do they still like will be look small because she eats a lot? I see her; she eats a lot, but she's not gaining. She's losing weight.
How old is she?
And I cannot help her. I want her to be ketogenic, but it's not.
What's her age? What is her age?
She's 23. She's going to be 24.
Oh, I was thinking like maybe 12 or 6 years old.
No.
Okay.
No.
So there's a couple reasons why there might be, a lot of times people are thin because there's some damage to the gut, pre-existing, let's say have history of antibiotics. Does she have any history of gut issues or not?
I'm sorry, she has what?
Digestive issues, gut issues, like does she have a history of antibiotics?
Yes, she did. Yes, she is, but her stomach like flat. She's very skinny.
Yeah.
And she has like almost the same problem when I was like, if I don't eat, I have to eat at that moment, and I know it's a insulin resistance, so I have to eat.
Yeah.
And she has same problem, but she's skinny.
This is what I would do. I think there's an older pre-existing gut problem that's preventing absorption of the nutrients 100%, in which case you want to heal the gut lining with several things. Glutamine is a good one. I actually did a video on the gut lining. I would watch that whole thing and have her do that, because I think what might be happening is the little villi in the small intestine might be not 100%, and that's just preventing the absorption. So she's going to probably have to take like some amino acids and things like that. She might have to keep her carbs, like let's say at 60 grams a day, not 20. And maybe she does 3 meals, but no snacks. That's what I would do. But I tell you, that gut can prevent absorption of food to the degree that you're going to have a hard time gaining weight. But I should probably do a follow-up video on that specific question. Okay, thanks for your question. All right, Karen, what do we got?
Okay. So we talked about something earlier this week that I bet a lot of people don't know, and I want to do a quiz. Here's the quiz.
Oh, okay, good. I was like...
Here's the quiz. If you're familiar with the Dr. Berg products, which of the products would you say is the best multivitamin of all the products? There is one, I learned, that is ideal as a multivitamin per Dr. Berg's recommendations. So let me know if you know which one that is.
Oh, that's
so
a good
you
one.
can answer that question.
That's a very good question, Karen.
In the meantime, I'll give you a question.
Yeah.
So Lori on YouTube says, what if carbs are the only thing that helps her sleep?
Well, carbs definitely help me sleep too. When I was taking like a pint of Ben & Jerry's a night, I mean, I was like in a sugar coma. So what happens with carbs is it increases insulin. Too much insulin makes you go to sleep just after a Thanksgiving meal, right, Steve? Like when you eat a Thanksgiving meal, you want to take a nap, right?
I eat Melba toast for Thanksgiving.
Melba toast. It has been so long since I've had Melba.
Oh, and water.
Oh, water.
Yeah, right. So it's not the best way to go to sleep. I used to have a sleeping problem so bad there was nights I'd even sleep 1 minute. You remember that? I had restless leg syndrome. I would get up in the middle of the night and go for a jog to get the energy out of my legs. So little did I know, those carbohydrates were pretty much keeping me up. They helped me go to sleep, but then I was up, so I didn't have the energy during the day. Well, guess what? Vegetables are carbohydrates. So she can do unlimited carbohydrate
Lori,
vegetables.
You didn't see that one coming, did you, Lori?
What will happen, I think you just need more minerals. I think you need more potassium. I think you need more magnesium to help the nervous system so you can get into the deep delta wave sleep. That's what I would recommend. But when you start going the carb route, it comes with a package. But I do understand the frustration of not sleeping. All right.
Okay. Do we want to hear the answer on this? I think.
Yeah.
Okay, good. So a couple of people were right. There are answers all over. I would say, oops, sorry, Steve, on that. I had an itch. Sorry. A lot of people said nutritional yeast.
Mm-hmm.
Some people were saying cruciferous.
Mm-hmm.
And a lot of other answers.
Okay.
But some people did say the right answer. Do you want a drum roll?
Drummity, 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 drummity. Sorry, we got rid of them.
We got rid of all the sound effects. Okay, you want to hold it up? Just hold it up.
Oh, yeah. It's wheatgrass.
Wheatgrass. I did not know this. Maybe there was a video I missed.
Now, here's what people are going to say. Why don't you have the nutrition facts on the back of the label?
Dr. Berg, why don't you have the nutrition facts on the back of the label?
Well, partly because it becomes in batches, and they vary from season to season, and I have to change it, and it's very expensive to create that. But I will create a supplement fact. Just I probably won't be able to keep up with the different batches. But here's the thing: it's if you're going to read this label as massive quantities of each nutrient, you're going to go, oh, it doesn't have as much as my Centrum Silver or my other vitamins.
Synthetic vitamins. Well, that's not the point.
But here's the point: they're very functional. They're literally, this stuff is raw, so the amounts you don't need them like this massive amount. The thing that this really has more than anything is the blends, the wide range of phytonutrients. Like I'm talking massive amounts of, like even one phytonutrient like carotenoids. There's like 600 different ones. Like this has such a blend of like a lot more than that. So you're getting those, you're getting minerals, you're getting
vitamins,
vitamin C, and you're getting the trace minerals because where it's grown. So it's very high quality, and it's so concentrated into just like one tray of wheatgrass into one little scoop. Okay, now that being said, there's some other things like the mitochondrial energy is another good multi.
One person said that.
Because it has, there's really not, it was very hard to find natural vitamins, I'll tell you right now, from food-based. But that one has a nice blend of natural vitamins. And it's really heavy on more of the Bs and things to fix the mitochondria. Then we have the the keto essential aminos, which are just amino acids, which are awesome because you don't really waste any of it. That's like 99% absorbed. Trace minerals are just trace minerals, but the nutritional yeast is a combination of B vitamins, trace minerals, and amino acids. So there's different types of products with kind of like can come close with that.
But the best one is?
I think this one right here, nutritional.
But apparently, if you answered mitochondria, you could be using the mitochondrial product as a multi.
Yeah. Yep. When you take this, though, you're going to feel, like some people say, I feel cool behind my eyeballs. Like it's just like all different reactions. Like I feel so calm, I feel relaxed, I have more energy. It's just, it's the highest quality product that we have.
Cool behind my eyeballs.
Don't you want that effect? Wouldn't that be cool?
Just the
Wouldn't
other
you like
day,
cool eyeballs?
I was thinking, man, would I love to be cool behind my eyeballs.
I would.
Hey, someone asking about insomnia. Now, Steve, you need something?
Put your products on the table, Doc. I want everybody to see what they are.
Yeah. Okay. So what?
Insomnia, help for insomnia. There's no information on whether this person is doing keto or intermittent fasting.
Yeah.
And insomnia is a diagnosis, but not sleeping good.
There's like really common reasons why people aren't sleeping, and then there's less common reasons why people are not sleeping.
Right.
I think the most common one is just stress in general, and there's a great webinar that I did called the Stress Webinar, which actually goes through these techniques that you would do, and you'll sleep like a baby. Of course, babies are up all night crying, and then the other thing is like drinking too much caffeine through the day. That's a common one. Not eating enough food it's high in potassium, because potassium is a relaxer. So like if you have no vegetables and all protein, that's going to keep you up. And then also, when you do keto and IF, and this is important, you really improve sleep apnea, so you have more oxygen. You improve getting up through the night urinating. You actually help your blood sugars. So right there, that should handle your sleeping problem more than anything. It's going back to the basics.
Mm-hmm.
On that note, Tom from Boston is on the line. How you doing, Tom?
Hey there.
We love
I'm
Boston.
Great. How you guys doing?
Great.
Good.
What's up, Boston? Let's hook up next time.
Okay.
Doc, I had my CAC done, and it wasn't alarming. It was like 93, maybe I think it was 93.
Yeah.
The score was, but there was a clog in my main artery. He said he called it the Mass Pike, and they wanted to put me on a statin and stuff, but I'm not willing to do that. I didn't want to do that. So I've been following I think it's the K2 and all that.
Mm-hmm.
A couple other things there. Do I need to clear it up? I mean, obviously I want to, because I was disappointed being so active as I am that I had any problem with my hard data calcium score.
How old are you?
I didn't want anything in there, but
How old are you, Tom?
I'm 53.
53?
53. Yeah.
I think is my 54 or 53? I think we're close to the same age. I think I'm 54. Am I? How old am I?
66 I was born.
Well, Tom, we're close. We're probably close to age here, and I do understand that you want that 0, and I highly recommend that you continue to do the K2 and the D3 to help with the calcium. I mean, you're still in a good range, so 93 is small. You can go over 1,000, and that could be very, very bad. But the fact that you have another clog, I'm assuming you're on healthy keto, intermittent fasting. That you want to do that hardcore. Like you want to get your carbs like way down there. I'm talking like probably 10 grams, and you want to do intermittent fasting maybe at 1 meal a day. I think that would probably be the most beneficial for your vascular system. Taking more potassium helps the elasticity of your arteries. Taking a very good vitamin E complex with all the tocotrienols and tocopherols together, that would be very good for your arteries. And that's what I would do. And also watch Ivor Cummins' videos on that, because he has a lot of great data. Thanks, Tom. Now, were you laughing with me or at me?
Of course I was laughing at you because every year since I've met you,
Yeah.
you don't remember how old you are.
I know. I'm kind of
You're
pretend-
54.
fif-
He's
okay,
54.
Okay.
Yeah. And, you know, at least you didn't go into the second part of that wondering that you usually go into because I'm older than you.
I didn't say anything.
And he usually
You're
goes
more- I
into
thought you were
some,
gonna
no,
say-
wait a minute, how old are you? Right, because you're, oh my gosh, you're that old?
I thought
That
you-
means I'm this old.
I thought you were going to say, I'm more mature than you.
No, I wouldn't say
No, you
that.
didn't say that. Okay.
Anyway,
He called you a cougar yesterday.
cougar, that's me. Yeah, that 2 years makes a difference. Okay, moving right along.
Henry, you're on the line. You're from Orlando, Florida. You had a question. Go ahead.
Well, yes, sir. How's it going?
Great.
First of all, I just wanted to say thank you for all your knowledge that you've been dropping on YouTube. I'm 30 years old, and I've been absorbing your channel for the past couple of years. So about, obviously, since I was born into a not so healthy lifestyle, eating junk food and fast food and whatnot. At the age of 18 or 19, I actually had my gallbladder removed. At 20, I got diagnosed with hyperactive thyroid, and I've kind of been battling those two since. I've been put on thyroid medications to, control the hormones, and with no success, really, I started having like a muscle dystrophy kind of symptom where I couldn't get out of bed and whatnot. So I've completely stopped taking any kind of medication and try to just treat it all naturally for the past few years. Just kind of in limbo right now with my treatment. Like I said, I'm 30 now, so it's been about 12 years. And I've got these two things that are kind of, I think, obviously it might be a byproduct of the surgery, according to what I'm kind of reading and understanding, on top of maybe also some maybe stressful situations that I was in when I was younger, at work and whatnot. I'm just trying to figure out what you kind of think about this scenario and where I should kind of go with a treatment protocol for it.
So do you get bloating when you eat?
I get bloating when I eat certain foods.
Okay. All right.
So like if I eat fatty foods, greasy foods, those kinds of foods, yes.
Okay. So let me just give you my two quick cents on that. You kind of caught between a rock and hard place because normally without a gallbladder you're deficient in bile, and you can just take bile and you can really help the situation greatly. The problem is when you take bile, it's going to make your thyroid faster, and you already have a fast thyroid called Graves, so that might speed up the thyroid if it's a hyperthyroid, but maybe not because did you have your gallbladder removed? I'm sorry, your thyroid removed too, or not?
No, thyroid's still there. It's goitered.
Okay. Do you have symptoms of hyperthyroidism? Like high pulse rate?
Yeah, I mean, it's high pulse rate.
Yeah.
Yeah.
Okay. So what I would recommend is I would do watch my video that I'm going to be releasing on this. It's going to be called How to Get My Thyroid to Work Correctly, and that will apply to a hypo, but it also applies to a hyper. The only thing you don't want to take is purified bile salts because that will speed up the thyroid more. That's good for a hypo. You want to take selenium. There's some nutrition you can take. You want to also watch my video on gallbladder flushing, which actually will manually just kind of help the bile ducts and the pancreatic ducts as they drain better into the small intestine. That's what you're going to have to do. You're going to have to just kind of really work on optimizing the drainage of your bile to maximize that and do really super clean keto and IF because you're going to be a little deficient in bile, and over time that can create issues. So, but I tell you what, I'll think about that some more, and I'll do a video for you on that, Henry. All right, Karen, do we have a quick question on your side?
Why does it have to be quick?
Okay, do you have a long question?
I have a super long question.
Okay.
Now, here's the thing you've never been asked before. Because there's a lot of questions that come up every single solitary week. And I'm always looking for a new question, and here's one.
Yeah.
What are the benefits of tomato and gumbo?
You gotta be kidding, right?
I know the
so
look on
gumbo is
I know
very
the look on
pleasurable.
your face.
Very pleasurable.
And the communication behind that blank look was, what's in gumbo? I don't even know how to answer that question. Let's start with tomato.
Yeah. What's the advantages and the disadvantages of eating tomatoes? Well, first of all, they are on the list with the highest pesticides, number one, unless you get organic. And unfortunately, if you live in America, they're kind of very empty. But I would actually, if you want good tomatoes, you want to move to Italy because they have the best tomatoes. What?
No, okay, now to the next part of the question.
Lutein, okay? There you have it, lutein. That's in a tomato. It's good for your eyes, and it can slow down macular degeneration.
And what
How about that?
That's awesome. And what about the gumbo?
The gumbo is a wonderful
Except I think there's a lot
food
of rice
if you
in
want
gumbo,
to.
right?
If you
Don't
want
eat
to
it. Make it without the carbs and
you want
enjoy yourself.
Gain weight in an unhealthy way. Do a lot of gumbo.
Eat a lot of gumbo and a lot of cornbread.
Yeah, and then you're set.
And then you will have
you
an
can do an
abundance
experiment
of
of high insulin. You want to experience high insulin? Just consume some gumbo and just
Benefits of
let us know
gumbo.
how it works for you.
Yeah, I think what it comes down to is you're going to have to research that and tell us what the benefits of gumbo are, because I probably would be correct in saying that every family has their own gumbo recipe. People who are gumbo lovers have
I think you should do
grandma's gumbo
I
recipe.
think we're missing out. There could be something really good about gumbo that we don't know. But let's go to Josh from Mississippi.
Mississippi.
You had a question, Josh?
Yeah, man, how's it going?
Great, thanks.
All right, so 2015, I got diagnosed with Rocky Mountain spotted fever. Never even heard of it up until that point. So I took the only medicine to get rid of it, and it's just left some lingering effects. So I found your video, started fasting, started keto, and I'm really left with two symptoms that I can't seem to shake no matter what supplements I try. Chronic fatigue, and the other one is, it's weird. I don't wake up during the night, frequently urinating, but when I go to the restroom before I lay down in bed, in like 30 minutes of laying there, I've got up 5 more times.
Okay.
I don't understand what that is.
You know, most people will get energy when they start beefing up, no pun intended, vitamin B1. That's a nutritional yeast. And when they start taking more potassium, those two, they start having more energy. But in your case, I think you have an active, it's called a latent activation of either some viral thing or some microbe that is sucking your energy because your immune system is fighting it, creating this fatigue. And that would make sense because it could be in the bladder area, affecting the nerves that go to the bladder, or the function of the nervous system that affects the bladder. In that case, what I would do if I were you is I would take probably a combination of things on this video that I'll release on antiviral things like oregano oil. I would take that to clean up maybe internal infection. There's garlic you can take, colloidal silver. These are just things that I think you're going to have to kill off this microbe. In addition to doing the keto and IF, you might have to take something to clean up kind of like as a natural antibiotic without the side effects. All right, Josh, thanks for your question. And Karen, over to you. Do you have a long question?
I think we've hit this a lot of different ways. But insomnia.
Didn't you just ask this 2 other times?
People are asking.
Okay,
I mean,
so
there are a lot of questions.
If there's a lot of questions on insomnia.
There's a lot of questions also here, as usual, about very specific diagnoses. And we don't take those questions.
How to cure cancer in 3 easy steps?
Right. How can I cure my
disease
this or that disease? So if you're new to this, we don't take those questions because we don't cure anything, and we don't address any kind of a medical disease. So
And-
if you want help with sleeping, or you want help with the healthy keto diet, or you want to learn how to, you know, heal your body with foods and stuff like that, that's the route that we go. And I'm not avoiding your questions,
We're not evading your
except for the fact
question.
that I'm avoiding
Because it's illegal to cure people in the state
question.
of Maryland or
in
Virginia.
any state in
So
the United States.
if we went over the border to
curing
West
people's
Virginia, we
against
could
the
probably
law.
do it, but not in this state, unfortunately.
Not even in West Virginia.
Okay.
I'm sorry.
All right, darn
It's
it.
So
Okay, let's talk about insomnia then.
yeah,
That
let's
seems
just
to be the
talk
topic.
about insomnia. It's coming.
Yeah, so vitamin D, if you're not able to get, well, first let's just say vitamin D. Vitamin D is like, if you take 20,000 IUs, that will help to fix a mechanism in your brain that helps you get into the deeper delta wave sleep. Vitamin D is just so important for sleep. This is probably why when people maybe go on a vacation and they lay around on the beach, they're on a cruise liner. Now that could be some other reason why they're sleeping. But all the sun just helps them turn off so they can actually wake up and feel rejuvenated. So that's one thing. Also, you want to kind of like perceive what part of your body is like tense or tight or in some type of spasm, something like that. Like you're laying down, you can't sleep. Is it your head that's busy? Is it your chest? Is it your legs? What part of your body? And there's a video that I did that I show you using this tool, massage tool. Use that, or your hands, I show you both ways, on how to extract all the accumulated stress that's in your body. It's pretty cool. I think you'll like that, and it'll actually help you sleep like a baby. And
Here we go again. Say it.
babies are up all night crying. Okay. Now it should actually really, it's pretty awesome, and it's a little long, so watch it when you have time, but I think that's going to help you drift off. I mean, like I would do this technique on people in my clinic, and they would literally fall asleep while I'm doing the technique. And they're snoring as I'm doing the technique. So it's pretty relaxing.
There you go.
Go ahead.
Okay, say you have someone already with a traumatic brain injury.
Yeah.
And what kind of foods or what approach food-wise would you take?
Mm-hmm. Good question, Karen.
Yeah. I wish I thought of it.
There's two things. I did a video on head injuries. They should watch that because there's a very cool technique that can help that condition, especially the trauma in the skull itself. But to actually help heal a traumatic brain injury, you want high levels of DHA. That is omega-3 fatty acids. It's a very, very high in shellfish, not to be confused with the word selfish. It's also in salmon. It's also in clams and things like that. We already mentioned that. But if you're a vegan, you can get it from algae. But it's hands down one of the best things to help heal the brain. That's what I would recommend.
Okay, good.
And one last thing, I just thought of that. Ketones are the best fuel for a damaged brain. So if your brain is damaged, I mean, and you want some more brain cells,
exogenous ketones.
I would go a different route. I would do the MCT oil. And there's many different types of MCT, like there's C8, C10, and the one that you want to get is C8, and you can get C10. But that's pretty much in most MCT oil products. But that'll give your brain the ketones that it needs directly, and also if you have a bad heart or a broken heart, take ketones. That will actually heal it as well. There's a little sarcasm with the broken, but you know what I mean.
It was a little keto humor.
Keto humor. I think I'm going to go on the road with that.
I think you should.
On that note, Maria, you've been waiting. You're from Green Bay, Wisconsin, right down the street from Kenosha, Wisconsin. How are you?
I'm okay.
Okay, good. Well,
I'm tired.
You had a question. What was your question?
I had a stroke last year in September on the day of my grandson's birthday. And I didn't know I had it until I went to go see the doctor a week later, and I told her all the symptoms that was going on. It was a right brain stroke. But she was been trying to make me take statins for a number of years since I've met her, and I didn't want to take it. So when I was on keto, low carb, high fat, for about a year, I lost a quite amount of weight. But when I had that stroke, all these people are like, "Oh, that's because you were on that, you were on keto. You shouldn't have done that. That caused your stroke." And it put a lot of fear in. My doctor said, "This is the reason why I needed you to take statins, so that you wouldn't. You need to take it so you wouldn't die and stuff like that." And she wanted to start me high at 100 milligrams. My heart specialist said I could start low at 5. Well, she wanted to keep rising it, but every time I took that stuff, I would get bad cramps.
So
really bad cramps. I couldn't sleep.
I'm guessing your question is, what should you do if I were you, right?
Yeah, because I want to get back on the keto, low carb, high fat. Since they told me later that was because I had an old where they check it in your neck there.
Yeah.
It was 50, 60.
Yeah.
And they said it was old, so I had it for years. So I'm wondering, would it help me with that, or would I have to be worried about it?
You know what you should do, just for your own peace of mind, if you just search, research, study stroke and low carb, or stroke and ketones, you're going to find a lot of data that being on ketosis can actually is more preventative and is protective from brain injury and stroke, and also from preventing clotting. I mean, think about what caused the clot. It's the high insulin from the high carb diet, not the low carb diet. And then they're going to put you in a statin, which is going to block all your ability to make cholesterol, and then that gives you a series of side effects. And I would ask your doctor to please just give me one study that shows that statins will improve my strokes even by 0.001%. I would love to see that study. So that doesn't make sense to me, but I can't tell you not to take it. That's your own choice. But I would go on the healthy version of keto with intermittent fasting, and I would also take ketones. I think that's going to be important. The other thing that I would also look around in your area to see if you can do hyperbaric oxygen therapy. I'm doing that myself. I think it's awesome to repair tissue, especially in the brain, so because it forces oxygen in your brain. Thanks for your call, Maria. And Karen, ready for another question? Let me guess.
No, I think we're...
Insomnia?
Are we done?
Insomnia?
What would you do for insomnia? Go ahead, take that one call.
If I had insomnia, I would...
go to sleep.
I would probably limit the amount of cell phone next to my brain.
Another good tip.
Keep the light down instead of not keeping the strobe light in your eyes right before you go to bed.
That helps.
And then we're going to go to Darcy from Texas. Are you there, Darcy?
I'm here. How are you?
All right. Hi.
Hi. I have a couple questions about my mom. She has recently not been able to taste food. She could taste that something is salty, but she can't taste, and it's driving her nuts. We were wondering what could be causing that.
That is a zinc deficiency. So if you can't smell or you can't taste, it's zinc, zinc, zinc all the way. So that should help you. That was easy. I like those easy questions. And then I think you had another one.
Is there a worry to take too much zinc? Is there a certain,
Yeah, I would not take more than the bottle says. Our bodies need a certain amount, and I would just take the regular RDAs. But if you take zinc for a long period of time, you could create some imbalances. But what you could do is just have her take like a good plant-based trace mineral product, which I'm not biased, but I think I have the best one. And then you take as a blend of all of them, and and then you just take the zinc on top of that. And let's say, for example, she's benefiting from that, but it's not really fixing it 100%. Then what that means is that she needs to acidify the stomach to absorb the zinc. And still, if it's not 100%, then we know she's probably having something like grains in the diet. I know that's probably not true, but she's probably 100% keto. But the grains, the fiber, the bran in the grains, that will have phytic acid, and that blocks zinc. That's probably the reason why 1 billion people on this planet are deficient in zinc, because they have whole grains. Okay? All right.
That makes it very simple.
Great. Thanks, Darcy.
The only other thing was, thank you. Bye-bye.
Okay, bye. I think I cut her off a little bit there.
Sorry, Darcy. If you had another thought, he probably would have taken that question. But it's 12:30 anyway, and that was an hour, and that's all you can take of us, I'm sure. It's like the maximum amount. You're busy people.
They got things to do. They got places
to
go.
You're like, I have heard enough.
But I really appreciate you guys coming on and your attention and your wonderful questions and your wonderful comments.
Asking a lot of good questions.
And the compliments on Karen's hair.
And the compliments for Dr. Berg. A lot of people love you.
Really?
There's a lot of, I love you, Dr. Bergs.
Wow.
Yeah.
Thank you.
I didn't say it all, but.
That's nice of you. Okay, so next week we'll see you on Friday. Have a wonderful weekend. And do you want to say any less?
Have a great week.
Okay, good.
Bye.